You've had your beautiful baby, but nobody's talked to you about the night sweats or why you're feeling exhausted and starving and so emotional at the same time. I'm Zainab, I'm the pharmacist from PillSorted, and I'll explain what are the labor stages, what's the biology behind it, and what happens to our hormones. So in a nutshell, it's not just a shift in our hormones, it's like a proper crash of our hormones after the labor. Labor itself is a very fascinating, coordinated biological process that helps the baby being delivered. It's got three distinct phases to it. The first one is the latent phase, which is called the early labor basically, and where the contractions start building up. The tricky part about the contractions it's not an on and off button. It's a very gradual thing, and there might be fake ones as well. So there's two signs that can help you realize if the real labor is going to start. One of them is the mucus jelly-like plug, which comes undone, and that's called the show. The other one is your water breaking. So that means you feel as if you're suddenly having a wee. So these two can be the signs, but there are these fake contractions that are called the Braxton Hicks as well. These are muscle contractions, but they're not the labor contractions. So they feel the same in that your whole muscles become really tight and you feel as if you need to go to the toilet all the time. But the Braxton Hicks ones, or the fake ones, can usually relieve by some resting, some warm bath, and they'll get relieved. Whereas the first stage of labor, when it's starting to happen, the contractions become stronger, become more regular, and become closer to each other. So that's the way that we can differentiate them. Again, if you're not sure at all, call the midwives, call the doctors, and they'll advise what's the best thing to do. The second stage is when the dilation has happened halfway, so almost. Contractions and the durations are getting closer and closer. When is the time that you need to be pushing and the baby to be born? So this is where you do need a midwife, a healthcare professional there to guide you through the steps, and they can support you for the delivery of the baby. And the third stage is delivery of the placenta, which actually happens about an hour or so after the baby is born. So these are the three distinct stages of labor. Where you give birth, it can be different places that you give birth. So it might be you are given the choice of home birth. There are some birth centers as well. So these birth centers have got a more homey feel. They're comfy, and there are midwives that manage it, and there is the hospital setting as well. So depending on what risk factor you are, what stages and coordination you've done before, you are given different choices, and there will be different levels of support. For example, you can't have a C-section in anywhere else other than hospital. You won't be given a home birth option. If it's your first baby, you will definitely be either in the birth centers or hospital. Now I want to talk a little bit more about the hormones that bring about all of these fascinating events. There is another very interesting hormone that comes into play. It's called the oxytocin, or the hug hormone. The interesting thing about oxytocin is that positive feedback that it does. So when you hug, the hormone creates more of itself. So that's a very interesting thing that it does. It is extremely high during labor, so it can create the labor and can make it get done faster. There are also a lot of endorphins. So endorphins are the ones that our body creates natural pain relief. But there are lots of different feelings that you will have all together. It is a very hard thing to do. So you will feel a lot of different things. Most of it is pain, but it's a very exhausting event. It's a very exciting event as well. So it's really important to focus on it's going to be over soon. So that helps get through it. There is a lot of different pain relief as well. So usually you can take, depending on the setting that you are, different pain relief will be available to you. Paracetamol and ibuprofen always, but there will be the gas and air during birth centers and in hospital, and there will be the strongest pain reliefs as well in hospital. For example, epidural, which makes you totally numb from the lower body, okay, which is only available in the hospital. So there's different levels of pain relief depending on how the labor is proceeding. What happens straight after birth? I want to focus on the mother's body. When the baby is born, the first thing that they'll do is they'll hand the baby to you, because that skin to skin helps the baby calm down. It'll help the baby's temperature and breathing regulate, and it will help trigger the oxytocin and to create more. So that's the first thing, and it's also a very sweet moment. It feels a huge relief for the mother when you have the baby in your arms. The second part is tears. So 9 out of 10 women who have vaginal births actually get a tear. This is a huge number, but usually women don't talk about it, but it is really important. It has a huge effect on the rest of the mother's life. So tears are very, very common. It's really important to know how to handle it, and depending on the labor situation and how the delivery is happening, the tear can be quite serious or it can just be a minor one. If the baby is helped out with a forceps, so it's a device that helps the baby come out, they would usually make an intentional cut, which actually prevents bigger tears. Anyhow, these tears, they're usually repaired with dissolvable stitches, and it takes about a month to heal. But it's really important to know that there is a tear and you need to take care of it, and if there's anything that's uncomfortable or out of the normal, you do need to get support for it, okay? The other things that happen to your body, you will have a lot of bleeding. The bleeding can take up to a good couple of weeks. It's really important not to use tampons at least for 8 weeks. Just use maternity pads, because we want to make sure that the body stays clean and it's easy to flush out everything. The other big change that happens is in your breasts. At first, your breast will create a very dense, creamy like substance. It's called the colostrum, and it's quite tiny amount, but it's exactly what your baby needs. It's exactly filled of the highest packed nutrients that the baby needs, plus all the antibodies that it needs to keep safe. So that's really interesting. From day 3 and 4, you'll see the milk coming more and your breast producing much more regular milk. And the third one is you won't have full control of your bladder, especially if you're coughing, laughing, you'll have leaks. Again, that's quite normal, and pelvic floor exercises, which we'll touch base in a future video, is really important to support you to get back that control. But at the beginning, it's quite normal, don't worry about it. The last one that I want to talk about, changes in your body, is the hemorrhoids. Hemorrhoids happen, they're quite normal. Plenty of fluid, trying to keep on the soft side, not getting constipated is really important, especially because you will have a very challenging time of cycles of 2 hours with the baby. So it's really important to keep hydrated, plenty of fluids and fibers in your diet. The first hormones that have a huge drop after labor are the estrogen and progesterone, and that's where the night sweats happen. So you might wake up and you're just drenched in sweat. That's the estrogen level that's dropped down. And your weight change after labor, the first changes come from the baby coming out, the placenta coming out, and the amniotic fluid. But the rest of the weight change is very gradual. So you won't have the whole weight that you've put on go back to normal straight after labor. That takes time, and that is intended. That's part of the natural process to do it gradually. The same about your metabolism. So if you go on to breastfeeding the baby, you will need around 500 calories extra to be able to support the baby with the breastfeeding. And bear in mind that you're already going through recovery. You're recovering from delivery of the baby, and on top of that, you're making more milk to support the baby. So that needs a lot of calories, and it needs a lot of rest as well. The other thing that is happening in your metabolic systems is the insulin resistance is gradually getting better. So around week 6 to 8, you will have another blood test to see your blood sugar levels, and you will see gradually the glucose levels getting back to normal. But if not, we can monitor and put you on the right medications. Some people become really anxious. There's a lot of competition sometimes, especially first-time mothers, that they want to get that body back in control. They want to feel like themselves again. The biggest important thing is please be patient. These will happen, but it takes time. If you worry too much about your weight, you won't be able to support yourself or the baby properly at this very intense time. For your weight gain as well, if you want to go back onto medications, at least 3 months after the baby's born. If you're breastfeeding, you won't be able to go back onto medications for for losing weight. But in general, you will be able to get back in control. Just be patient. One more thing to talk about. Again, we've talked about baby blues. This happens, but if after 4 weeks you still feel really low, that you can't cope and you don't feel that you can get on throughout the daily lives, these might be the postnatal depression. Again, it is common, and if you feel like that, it's definitely worth talking about it to a healthcare professional so we can see what kind of support you need to be put in place. As a recap, labor is a biological process and there are stages that your body has designed for it. After birth, the hormone crash is real and recovery takes time. You will be slowly adjusting and getting back to your normal self, but just be patient. This video is part of our pregnancy series videos. Visit our website and reach out to us for that clinician-led safe advice. Thank you.